So understanding the knee joint. The knee joint is a very complex joint, and it is encapsulated within 4 bones. Now, don't mind a lot of the fancy words that we're going to be using today, but just pick a note and take a few points. So we have the femur, which is a large bone. Then we have a tibia, which is the second bone. We have a patella. The patella is an interesting bone that forms only after 2 years of life. So when I had my first daughter, I went and I was expecting, because I know when to feel for her patella. So each time I go to her and I'm like, honey, can I feel your knee? Is your patella coming out? And voila, when she was 2, I saw it. So in the second year of life, we begin to develop our patella. But of course, the femur and the tibia had already formed. And they are all encapsulated within a joint capsule. And within a joint capsule, this provides that level of stability that we all need to do. Now, there is another thing you need to know about the knee joint. Knee joint is what we refer to as bicondylar. What it means, don't mind the fancy word yet again, it means that it moves only in 2 directions. It moves in flexion and it moves in extension. So flexion is this, extension is this. So when that happens, that allows us to go up and down the stairs. It allows us to sit. So imagine when you want to sit, you are sitting with flexion. When you want to stand, you are standing with extension. When you want to go up the stairs, your first step, you flex your hip, you flex your knee, then you go on the first flight, then you extend your knee so that you can also complete the cycle with the second slide. So the knee complex is very interesting, and I would also want to elaborate more by showing us what the knee looks like with this. So don't mind this, I call him Mr. Silvanus. Mr. Silvanus was our patient. So when he came, we treated him for knee pain that he never expected was going to be, that we never expected we were going to solve. So when he finished, he recovered, he donated his knee to us. So this is Mr. Silvanus' knee, but I'm going to use it for the purpose of today's presentation. So this is the femur that I was talking about, and the femur has a concave end. This is the tibia, the convex end. This is the tibia and it has a concave end. And you can see the tibia. And this is the fibula. The fibula does not actively engage within the movement in the joint, but it is important. A lot of us live our lives without the fibula. But what the fibula does is it provides room for attachment for a lot of muscles that aid our knee movement, stability, and mobility. So you see, God in His infinite mercy makes sure that He created us and every part of our body is useful and it's ready to perform a particular function or the other. Isn't that interesting? So there are lots of interconnectivity going on within the knee. And I want to also talk about something really very interesting, something a lot of us neglect. And when it begins to have issues, we tend to hear things like you need to get a knee replacement, you need to have numerous injections in your knee, even though we don't advise that, because there are so many researches that have come out in recent time to say that people who have multiple cortisone injections in their knee end up with degenerated articular surfaces. And once that happens, you are going to lose lots of integrity in the bone, you're going to lose the density in the bone, and you will be susceptible to fracture, osteoporosis, and even the pain will not go. And at the end of the day, you will come down with so many other medical conditions that you never anticipated. For example, when your knee hurts so much, you don't move so much, and when you don't move so much, chances of high blood pressure begins to come in, obesity begins to come in, diabetes begins to kick in. So everything is connected, and that is why we are spending so much time to explain exactly what it is we need to understand within our knee. Now we have the meniscus. The meniscus is what I would describe as a triangular lamellar kind of object. What does it do? It helps in distribution of force within the knee joint. And there are two meniscus. We have the lateral one and the medial one. It is shaped like a crescent. So a crescent is something that looks like a banana. But one thing with the meniscus is, not every part of it is vascularized. In fact, it is up to 2 years. There is something very spectacular about 2 years with the knee. Imagine in 2 years the patella begins to form. In 2 years of life, that is the last time you have full blood supply to the meniscus. So after 2 years, the red zone moves a little bit outwardly. Then the internal one do not have so much of a blood supply. So what it then means is, when you have direct injury within your meniscus, it will be very difficult for it to heal. But thank God, we have lots of amazing researches and interventions that can also help you live a well-fulfilled life, even if that happens. So within that meniscus, it creates that shock absorption for the knee joint. Because some of us must have gone to see the surgeons or the doctors who say we have our bones on bone. When that's happening, that means all the outer, the internal, the posterior and the anterior ones of your meniscus have degenerated so badly that you need to see a specialist who can intervene as fast. Because the bone ends, the convex end of the femur and the concave end of the tibia now begin to interact. And the meniscus do not have vascularity and sensitivity as the ends of the bone. So when it eats off, the crushing effect, the joining together of this upper layer and this lower layer gives you that excruciating pain that at the end of the day, the doctors or the surgeons may not have option than to prescribe a surgery, a knee replacement, an arthroscopic capsular release, so many other things that you may expect that has happened from something you probably would have prevented earlier on.